Welcome to Alternate Solutions Health Network. Our mission is to inspire hope and improve the quality of life for those entrusted to our care. Our network of professionals allows us to provide post-acute care for homebound patients, resulting in not only noteworthy quality outcomes, but by connecting with those in our care and turning patients into raving fans of our company. Our continuum of care begins at the point of referral for every new patient and continues even beyond discharge. Our home office is located in Kettering, a suburb of Dayton, Ohio, and is the base of our centralized operation that provides support to our valued clinicians, allowing them more time caring for patients. Our history begins in 1999 when we focused solely on non-skilled passport com care in-home assistance for the frail and elderly. 3 years later, we obtained Medicare certification and began providing skilled care to patients in a post-acute setting. Over the years, we expanded, not only in Dayton, but to Cincinnati and Columbus. Sharing our home care expertise with joint venture partners has allowed us growth across the region. Joint ventures with new and existing home care agencies allows us to share our expertise and improve patient care and quality outcomes. We've built relationships with hospitals, skilled nursing facilities, and physicians. This means that our care begins even before the patient is discharged. Once we receive a patient's referral, our hospital liaisons or community educators work with our patients to determine their need for home care and then obtain their medical records, orders, and required face-to-face documentation from the physician. They then fax that information to the centralized intake team, who receives thousands of faxes, secure emails, and epic direct messages each day. We are dedicated to ensure quality and customer service at every step along the way. Our authorization team pre-checks before a patient is seen to ensure quality and accuracy in billing. They may also contact our clinicians if an insurance company has a question about a patient's plan of care. The Patient Scheduling Coordinator, or PSC, then assigns a start of care visit to an RN, physical therapist, or speech therapist. During this visit, they will perform an evaluation and create the patient's plan of care in Point Care, an easy-to-use app installed on their mobile phones. Once the plan of care is completed, it is transmitted to the office where a clinical field staff supervisor, or CFSS, reviews and corrects the documentation. If clarification is needed, they will email or send notification through the PDA to the clinician to get important information before submitting the assessment to Medicare. Correct and accurate OASIS assessments and documentation are important to painting the picture of our patient's health condition and needs. During the patient's episode of care, they might interact with a clinical field staff liaison, or CFSL. This person is a clinical support for the field. They assist with day-to-day questions and are responsible for entering orders that are called into or faxed to the office. They enter lab results, talk to patients who call the office, and are also responsible for parts of the field documentation. DME can be ordered for our patients through our DME department by contacting them via email or calling in and asking for the DME department. They will then walk clinicians through the steps needed to order durable medical equipment. We analyze patient charts to identify patients who are at high risk for being readmitted to the hospital. Our specially trained RN high-risk specialists provide wellness calls to these patients throughout their treatment episode. Our quality department audits charts for regulatory compliance and verify quality outcomes are accurately measured. Finally, our billing department works to ensure proper and timely billing to CMS or the patient's private insurance. This provides peace of mind to patients and their caregivers. Our medical records team makes sure the patient's chart is complete. They do this by ensuring orders and other documentation is attached to the patient's records. During your training, you will see how each of these departments makes a difference in our patients' lives. At every interaction, our staff realizes that while every day is another day on the job for us, for our patients, it may be among the most difficult in their lives. By treating each patient with dignity, respect, and compassion, we are inspiring hope and improving their quality of life.